Welcome, dear Arzu Forough. Thank you for being here. I know you've done incredible work and it's such an honor to have you here. I can't wait to share some of your knowledge, some of your background with our audience. I know it's going to help a lot of people and inspire a lot of people. There's a lot that we can cover about your foundation, which is the Washington Autism Alliance. If you can share some information about how you started it, what's your personal experience, and anything else you would like to share with us about that, I know we would all love to hear it.
Absolutely. Yeah. Thank you very much for this opportunity. It's such an honor to be here. You are an impressive woman. I am just in awe with everything that you're accomplishing. Um, I am a proud autism mama. I have three generations of autism on my side of the family that we know of. My two sons are my inspiration for forming Washington Autism Alliance out of personal necessity in 2007. We moved to Washington State from Central Texas. I had done my homework and had chosen Washington because we had an amazing center of excellence for autism. We had world-class providers here, and my husband took a job right across the street from University of Washington's Autism Center. We were really excited to be near these amazing providers and come to a state that had started Education for All in 1975. Little did I know once we got here that everything that was available in the state of Washington was only accessible to the most affluent members of our community. My husband's health benefits at University of Washington did not cover UW's Autism Center, which was literally across the street from him. And the local elementary school where our boys attended had little to no knowledge of what it's like to serving two neurodiverse students on opposite ends of the autism spectrum. So the education program was also really lacking. It was in that space that I first became really depressed and almost paralyzed of what are we going to do? What have we done? We've come here and we've lost our insurance coverage and we've lost the school program that we had worked so hard to achieve. And then I fell back onto some experience that I had in the state of Texas, which was advocacy, specifically legislative advocacy. And that's what I started doing. And the more I looked, the more I realized that, boy, we're not alone in this. There's a lot of people who are similarly situated. Um, I think it was by 2008, within a year of me starting Washington Autism, at the time we were called Washington Autism Advocacy. Within a year, I was getting contacted by about 800 people from throughout Washington State who were similarly situated. And then by 2011, that number had gone up dramatically. And so I realized we either need to put some structure around it or put ourselves out of business. And we decided we're going to put some structure around it and add family navigation, add advocacy, direct advocacy, as well as coaching and eventually legal support for individuals who are autistic or have other developmental disabilities.
I'm so glad that you put up with the difficulties and the hardships and created this because you're serving the whole community now. And I've seen your website. It's so complete. It's so beautiful to see that you've put something together. It makes me so proud to see this, that somebody that I know a little bit at least, that has put something so amazing together. And it gives me hope, that if you can do this for people, if people come together, they can really help each other and we can be there for one another. So nobody, like you mentioned, has to feel like they're paralyzed with depression and sadness and like, how am I going to do the rest of my life like this? And what can I do to help my kids, because it's real when that hits you, like, my kids are suffering, like, what can I do? And you just feel like there's nothing out there. So I really appreciate what you've done. I really hope that it becomes, I don't even want to say national, but more like international, because it's something that everyone around the world is, dealing with right now. And we had another speaker talking about this issue, and we had some international students attending, and they say that in some parts of the world autism is looked at as something so negative that the doctors will go out of their way not diagnosing them, because it can even lead to parents neglecting or not wanting that child, or sometimes causing horrible situations where the mother is kind of put at fault and causes domestic violence. It's just so horrible that there's so much misinformation, misunderstanding, and fear, the stigma that is out there. And I really appreciate what you do, because we really want to battle that stigma. So then we can bring some healing and, create a space that's safe for everyone. And it can
Absolutely.
bring some information that it can actually lead to healing. Also, I hope that we can get more caregivers in the health system to really study this and bring some much needed relief and lasting help. So thank you again for doing that. I'm sure you face a lot of challenges. I think you mentioned some of your initial challenges that you faced. Is there any others that you would like to share and how you overcame them?
Sure. Um, there is such diversity in the autism experience. Because of that, it's very hard to reach consensus on what binds us together. And so early on, I decided I was going to focus truly on what brings everyone together. And I found that access to care, access to medically necessary, neural affirming, trauma informed care from the medical community, as well as effective education programs in schools, were two topics that really bind all of us together. There is no tension among us in the autism community that we need neuroaffirming, trauma informed services in order to thrive in our own communities. There is no contention around the fact that we need education in order to succeed in our communities, right? And so that's early on, I decided that those were the two areas that we were going to focus on. The challenge again was there is such diversity. How do you lift autistic voices, but at the same time advocate for a condition that can be disabling at times? That is an ongoing opportunity, I think, for us as a community to remember how can we uplift autistic voices? How can we make sure that our children are at the table making their voices heard and shaping public policies, at the same time helping people who don't know autism understand that just because a person can speak doesn't mean they don't need supports. Or if a person can't speak, doesn't mean they don't have anything to say. We need to make sure that people with all abilities have a seat at the table and are forming policy decisions. That's that is a Herculean task, I think, but it's one that that is really necessary.
Perfectly said. Yes. Thank you so much. And you put it so beautifully. I really appreciate it. Out of the significant achievements that you and the Washington Autism Alliance have achieved since its inception, if you can share it with us, we would really appreciate it.
Of course, yeah. So before we moved to Washington State, people with developmental disabilities had very little insurance coverage for medically necessary therapies and services that were specific to developmental disabilities. As an example, speech therapy, occupational therapy, physical therapy. There were combined, some of the plans that I had seen, there were combined visit plans of 12 visits a year. And if somebody has complex support needs, that doesn't even last a month. That doesn't even go a month for that person. And so one of the first things that I set out to do was to make sure that the parity laws, mental health parity laws, were applied to autism. Before I set out to do this, autism was excluded and developmental disabilities were excluded under mental health parity laws. I was the first person to bring this theory to a group of attorneys, and it took about a year and a half to compel them to actually look into this. And once they did, then our children became the named plaintiffs in a class action lawsuit against the state of Washington to clarify Washington state's mental health parity for autistic children and adults. And then once we reached a settlement with the state of Washington, then I compelled families who were insured by every major carrier in the state of Washington to participate in similar lawsuits to clarify federal and state mental health parity laws. By 2015, every single insurance carrier in the state of Washington had removed policy exclusions and were covering medically necessary therapies and services for not just autistic children and adults, but also anyone who had a developmental disability as well as mental disorders.
Outstanding. That's amazing.
That was a heavy lift, and it took many, many years. One of my attributes, I don't know if this is a good thing or a bad thing, is I stay with something that I start and I see it all the way through. For me, it wasn't enough to just get this settlement that yes, medically necessary services have to be covered for autistic children and adults. I needed to make sure there's also an adequate network of providers. I also needed to make sure that this is truly not just for pediatrics, but also for adults. And so we brought forward another challenge in 2020 to make sure that adults truly had access to the services that they needed as well, medically necessary services. So that is still, I think, fragmented for the adults. Services are still fragmented. If you think back of those early settlements, we've had a decade or more to make sure that we develop a healthy network of providers, but for adults, we still haven't. And so that's what I continue to grapple with. Also, Medicaid reimbursement rates, not just in the state of Washington, but all through the nation, all throughout the nation, the reimbursement rates are poor to the point that providers can't afford to serve the population that relies on Medicaid for their health benefits in par with private insurance. They just simply can't afford to see the population that needs care paid for through Medicaid. And this is really, really sad. In Washington state, about 50% of our children are insured through CHIP. Imagine if these children were given only 1% of the provider pool in the state, which is what we're facing right now. What we're facing is less than 2% of the providers are willing to accept Medicaid. It's a little better for private insurance, but it's even strained for private insurance providers that spend years and years and years, become specialized in the field, and work with autistic people of all ages, don't want to jump through the hoops of the administrative burden of accepting insurance, let alone they really can't afford to write off 70%, 65% of their professional fees to serve people who are Medicaid eligible. That's That to me is a huge problem.
I'm so proud of the work you've done and continue doing. I don't know if you have a background in law, but you sound like, a professional lawyer and policymaker. So
I'm a
amazing,
professional mom. That's all.
amazing. Yeah, super mom, absolutely a super mom.
That was by far the farthest reaching work that we've done and continue to do. But there are other things that I think have greater impact on the livelihood of the individual. As an example, it was brought to my attention several years ago about a practice of isolating and restraining students with and without disabilities in our public schools. When I became aware of this and took it to various legislators, they were rather dismissive that this was a problem or that it was even happening. But fortunately, we had a group of advocates that felt very strongly about this. There was a particular advocate who is now a special education attorney in the state of Washington, and she was very passionate about taking this on. And so, with her help, we were able to compel the state of Washington to start collecting data on how often this happens. We went back to the legislature 2 years later with that data, and they were just so shocked by how prevalent this practice was of secluding and restraining students in public schools. It was most often happening to students with developmental disabilities. And so that legislative session, we were able to pass a law that regulates the use of seclusion and restraints in public schools. The only time that an educator or a safety officer is allowed to put hands on a student is if that student is at imminent risk of serious harm to themselves or another person. And that, even though is um, not as far reaching as hundreds of thousands of people, I think it has the greatest impact because the potential for harm for someone who experiences this is great. Both the person who's doing the restraining and the person who's being restrained.
Absolutely. And it's amazing that, you were able to do that because I have clients that are struggling at school, like their parents tell me the stories. And it's really scary because as a parent, especially not knowing what's happening to your child, when you're trusting these people to take care of your child, and sometimes you hear horrific stories. So I really appreciate that this is happening. Is this for just Washington right now, or is it
It
like
is, yeah, my um, organization's advocacy efforts and legislative advocacy is primarily Washington state. However, other states have then modeled legislation after us and have been able to implement similar policies in other states. But most of our activities on this issue has been it's Washington state only.
I just need you to, be in Congress and get you up there because, your work is amazing. So and I know you've done some work that also affects us nationally as well.
That's right. That's right. Yeah. When the Affordable Care Act was in markup in Congress, I was in the midst of an appeal for my own children against the state of Washington. At the time, my husband was a state employee, and so I was trying to clarify health benefits for them, and we were involved in that initial class action lawsuit that I told you about. Because of that, I was able to compel um, then Congressman Inslee's office, who he later became our governor, but his staff were able to put in the ACA implementation documentation what it means to cover a child's medically necessary therapies, what it means to have medically necessary screening, diagnosis, and therapies for a child that has autism. And I think that little uh, just in time, just in case markup made a huge difference nationally for what became the basic basic services for autistic children throughout the nation, as well as adults.
Is there anything that individuals can do to support you, support the work that you do?
Thank you. Thank you. There's so many ways to get involved, right? There's work cannot get done in silos. Um, One of the ways that people can support us is by giving time and by giving expertise. We are a very small organization. We do very impactful work, but we are very small and we operate on a shoestring budget. And so, if anybody is willing to get involved to make a difference in the state of Washington or the nation, we will take any contribution, whether it's time, expertise, or funding.
Perfect. And I will share your website
Mhm.
too. But regarding the time and expertise, is the funding also, I think the donation link is on your website. Is that correct?
Yes, yes.
How do they get in touch with you regarding time and expertise?
We have a volunteer coordinator, and on our website, there is a volunteer link with opportunities that are available. Not every volunteer opportunity is on our website. So our operations manager typically is the first person that hears from potential volunteers and hears about their interests, and then she meets with them and finds out what they're interested in, and then puts them in touch with the right team member. If they want to work with family services, she puts them with that team. If they want to get involved with philanthropy, then she puts them in touch with our investments and partnership team.
Perfect. So it sounds like they can email you and then they can help them along once
Yes, they
they.
can definitely go on our website rather than email. I think on our website, going to the volunteer tab. Virtual volunteers are golden.
Okay,
So
perfect.
many of these opportunities are virtual.
Perfect.
Um,
Okay. Do you guys also offer any kind of like a letter at the end or when if
Yes,
you okay.
yes, for our internship, absolutely. We offer recommendation letters. We have had volunteers that needed to document their hours every week. We are pretty well mobilized to offer all of that. We've had a lot of interns that have done um, they wanted to get involved with legislative advocacy and they needed to learn ins and outs, and they were putting in considerable number of hours. So we've developed internship programs for people who want to learn about legislative advocacy, as well as other we have multiple different internships.
Wow, amazing. I know a lot of students that actually have asked about opportunities for internships. So this is amazing. And I know internship can be a little bit different. Can they still be virtual or they have to be in person?
Yes. No, it's most of our, so if there is any silver lining with a global pandemic, is that we became really mobilized to take our services to the most remote parts of our state by using technology, by using virtual platforms. And we worked really hard in making sure that we are still HIPAA compliant using Zoom and using platforms that are HIPAA compliant. We have created not only virtual volunteering opportunities, but we also provide services virtually to, like I said, pretty much anywhere throughout the state. It used to be, I don't know why we didn't think about this sooner. It used to be parents used to come from all over the state to attend a training workshop. Some people would their travel was like 6 hours. They would travel from one side of the state to get to us to attend a 6 hour training workshop. Ever since we've had it on Teams or Zoom, people don't have to battle the childcare and gas prices and taking time off from work. It's become really accessible.
Thank you. Yes, you've done an amazing job making it accessible through the years, and I'm sure it's going to get even better. You know, you've done so much, but I know you to make this work, everybody has to get involved. So I'm really excited that there are opportunities for others to help out. And
Thank
for this year, though, for 2025, I know you're very busy because you're just amazing and getting so much done every year, every month. Are there any specific things that you want to mention about some legislative sessions underway and
Yeah,
maybe some of your top priorities?
yeah, absolutely. Thank you for asking. A couple of years ago, I brought a proposal to the Washington State Legislature called Enhanced Behavior Support Homes. This is intended for people who are experiencing inappropriate hospitalization because of mental health crisis or behavioral health crisis. They're at risk of out of home placement, or they have been displaced. They've lost their access to either family home or adult family homes. So for this population, which is not a very large population, I brought this proposal to the legislature, and unfortunately, at the time, we were not um, mobilized. I think we were not mobilized enough to truly educate the legislature on why this is so necessary. But we were able to get a budget proviso for the state to study the feasibility of this, and that report is due to the legislature on June 2nd of this year. And then it's my hope that that report would lead to a proposal for a bill for either next session or the following session. We have budgetary sessions every other year. And so that's my hope is that that would become a bill that would be presented in the Washington State Legislature after that. And so that's one that I would like to see people get involved with.
Yes, that's absolutely outstanding. And thank you for putting it together. But is there any way that people can help support it?
Yeah,
With their hand?
yeah. On our website, anybody that does a search for enhanced behavior support homes, they'll be able to read the history of the intended recipient of this service and what has been done up to now and how to get involved in the future. In fact, I right now am looking for an intern that wants to get involved with government relations and legislative advocacy so that they can help us with the community engagement and civic engagement for the next 7 months before the next legislative session.
Do they need any specific type of experience that you're looking for? Because I know there are psychologists that go into policy making, there's lawyers, but are you looking for a specific
I,
degree?
yeah, so I personally look for people that want to get into shaping public policies. Um, Either go to law school and then get into legislative advocacy, or they have finished their coursework and are interested in shaping public policies, and so they want to work in the legislature in their own state, in their, wherever it is that they live. Of course, the ideal candidate would be in Washington State so that they really learn the ins and outs of our state, but a lot of the work is transferable to other states as well.
Completely understandable, but yes, I'm really excited and I hope you find the person that you need very soon.
Oh, from your mouth to God's
Yeah.
ear.
for the future vision of, for Washington Autism Alliance, what are some of your long-term goals, and how do you envision the
I
organization's
do want
role?
to, I would be remiss if I didn't mention that we also have a wonderful internship for social workers. If they want to go into social work, they can get real life experience on how to do intakes, how to do needs assessments, how to help with resource coordination, how to navigate multiple systems of care for their clients. And so I think that is an ideal internship for someone who's going into social work.
Perfect. I thank you for mentioning it so I can make sure to highlight it as well. So, social work, law school, or familiarity with law. And also, I know there's public policy majors now too. So maybe
Right.
also that.
Right.
Yeah. Okay.
Yes.
Perfect. Perfect.
And anybody who is in nonprofit management also, they can get real life experience on how to run a nonprofit by getting involved with our investments and partnership team.
I hope that we can help out with sharing this information. And I hope all the right people come to you because you deserve all the help you can get. You're doing amazing work. And I can't wait to see the future of this organization, and how much it will help people. But speaking of future, what are some of your long-term goals, and how do you envision the organization's role in evolving in the next decade, maybe?
Yeah. Um, if I were to tell my younger self 10 years ago that we were still trying to help school districts implement IEPs with fidelity, I wouldn't have believed it. I would have thought we would have come farther along. And so my hope is that we get a lot more training in universities, both in education as well as in medical school on autism and the broad spectrum of autism. My hope is that 10 years from now, people who are non-speaking, who are using alternative and augmentative communication, are able to access regular education and be able to learn alongside other learners in our public schools. That would be a dream come true 10 years from now. The other aspiration for me is to find a way for our adults with complex support needs to also have equitable access to the supports that they need in order to access employment, have a full active day that is, activities that they enjoy doing, not just janitorial and facilities work, right? We all deserve to have access to day programming that we enjoy and allows us to have a fulfilled life. So that's my other aspiration.
Amazing. Yeah, everything you say, just, I can tell that you do this from the heart, and is you do it so well too. So I appreciate that, someone with your talents, with your capabilities has taken over this and bringing something amazing to life. Um, but reflecting on your journey, I know you've done a lot of amazing things, but reflecting on your journey so far, what has been the most rewarding aspect of your work?
I think the difference that we make in the quality of life of the people that we work with, that is really rewarding to me. Whether we have little impact, such as a person not having to choose between whether they buy presents for their children during the holidays or take them to a speech therapy appointment, not having to choose whether they pay rent versus getting therapies that their child needs. That to me is incredibly rewarding that people don't have to make those kinds of choices.
Yes, very well said and very well understood. Yes, I've seen the struggle. I have been through the struggle too, and that's amazing that, you care so much not just for, your own children, but you're doing it for so many others. So I hope that you get to see your work pay off internationally and soon. I wish you so much health, happiness, success along the way, and many helpful friendships that can bring your dreams to life. But before we go, I want to ask, what message would you like to share with our listeners about supporting the autism community and the WAA's efforts?
I wish I could say this succinctly, but truly including autistic children and adults in a community takes intentional effort and intentional time. Whether you work in a grocery store, or you work in a school, or you work in a library, if you're in the presence of someone who is struggling to fit in, struggling to communicate, or struggling to just be among others, you can make that person feel more comfortable. You can find a way for that person to feel included and belong. So for me, the if I were to ask community members if there's one thing that they can do, it would be that. I am so grateful to grocery store employees that go out of their way to acknowledge my son when he's in the store shopping. I'm grateful to that thrift store owner that sets aside CD cases for my son because he knows that he is somebody whose CD cases often get destroyed inadvertently. And so it's these little gifts from community members that make such a difference in a person's life. The other for Washington Autism Alliance, we need resources and funding to get work done. And so I want people to remember us and consider us as one of the 3 organizations that they support through philanthropy.
Absolutely. That was beautifully said. Thank you for sharing. And thank you for being here. It's such an honor to have you here. The more I learn about you, the more impressed I am. Just so kind, so talented, so smart, and so giving. I wish you all the best. I know your schedule is super busy, so I really thank you for being here with us today. And I can't wait to share it with people, especially the parents that are struggling. I think this is going to be really helpful to them and people who are interested in this field to study it more, to be in the public policy and advocating for neurodivergent people. Thank you again for being here.
Absolutely, my pleasure.
Facts in Mind is a podcast for curious minds. We explore everything from science, psychology, and technology to education, culture, and public health. Be sure to follow and subscribe so you don't miss on exciting episodes with the latest thoughts and research from our expert guests.